In this session, we will discuss medications that can be used to treat nerve pain, also known as neuropathic pain. The learning objectives for this presentation are to describe the typical presentation of neuropathic pain, to review medication classes available to treat neuropathic pain, and how to approach their use in older adults. Refer to LexiComp at the web address on the screen for more information about these medications. It is important to determine what types of pain someone has in order to ensure that the appropriate medications are chosen for treatment. Neuropathic pain can present in many ways. Individuals may experience allodynia, which is the experience of pain from a non-painful stimulation, such as a light touch to the skin. Neuropathic pain is sometimes described as burning, radiating, shooting, or an electric shock, although these descriptions are sometimes used for other types of pain as well. People can also describe paresthesias such as numbness or tingling with neuropathic pain. There are several questionnaires that have been developed to screen for possible neuropathic pain, such as the DN4, Neuropathic Pain Questionnaire, and Pain Detect. However, we will not describe those in this session. Neuropathic pain can arise from an injury or disease to a nerve in the central or peripheral nervous system. Examples of central neuropathies are a stroke, spinal cord injury, or multiple sclerosis. Examples of peripheral neuropathies are trigeminal neuralgia, diabetic neuropathies, or shingles. Some conditions affect both the central and peripheral nervous system. Nociceptive pain can also be present with any of these neuropathic pain types. Treatment will be most effective if medications are selected based on the type or types of pain present. There are numerous medications available to treat neuropathic pain, making selecting the best medication challenging. Some of the options include anticonvulsant medications, antidepressants, topical agents, and certain opioids. General guidelines to treating neuropathic pain are to take the medications regularly, starting with a low dose and slowly increasing it as tolerated. These medications should not be increased too quickly, as it may take 7 days or more before they exert their full effect. The agents most commonly used for the treatment of neuropathic pain in the anticonvulsant class are gabapentin and pregabalin, also known as Lyrica. However, there are other options including divalproex and carbamazepine. Each individual medication offers differing benefits and risks, such as drug interaction and side effects. If gabapentin were the medication of choice for an older adult, the recommended starting dose may be 300 milligrams at bedtime. This dose could be increased as needed by 100 to 300 milligrams each week. The usual geriatric dose for gabapentin is 300 to 600 milligrams 2 to 3 times a day. There are many antidepressants to choose from to help with neuropathic pain management. However, nortriptyline and duloxetine tend to be used most frequently. While this class of medication has to also be started at a low dose and titrated up as tolerated, toxicity and anticholinergic side effects must be monitored. An example of dosing would be to start nortriptyline at 10 milligrams at bedtime. Should a higher dose be needed to better control the neuropathic pain, an increase to 20 or 25 milligrams may be considered after at least a week of treatment. Tricyclic antidepressants, or TCAs, are commonly used for the treatment of neuropathic pain and are best when used in the presence of comorbidities, such as neuropathic pain with depression or neuropathic pain with poor sleep. The side effects of this class of medication are dose-dependent, and this is why the lowest effective dose should always be used. The most concerning side effects with TCAs are anticholinergic effects, including dry mouth, drowsiness, confusion, constipation, and urinary retention. Nortriptyline and desipramine are usually recommended before agents such as amitriptyline, since they are less anticholinergic, resulting in less severe side effects. Topical agents, such as those that contain capsaicin, may help with nerve-related pain. The capsaicin will block the pain signal, decreasing the sensation of pain. Topical preparations that contain anti-inflammatories, such as diclofenac, are also available, but are more effective for muscle and joint pain. Opioids may be considered for a trial in neuropathic pain when first-line options like tricyclic antidepressants cannot be used or do not work well. Tramadol, a weak opioid, also inhibits serotonin and norepinephrine reuptake. This effect on neurotransmitters may make tramadol one of the first opioids to trial in the treatment of neuropathic pain. To summarize, neuropathic pain can originate from the central nervous system, peripheral nervous system, or both, and it can coexist with nociceptive pain. Neuropathic pain can be treated with various agents, most commonly anticonvulsants and antidepressants. Anticonvulsants and antidepressants must be initiated at a low dose and slowly increased over time as needed to avoid side effects.